particularly this morning, my laptop just wouldn't boot up. It's just making noise. So I had to switch over to another laptop and rely on I was at the verge of reaching out to Dr. Babashani to ask for more time so that I could do up what I had worked on before a little bit. But I just thought maybe I shouldn't do that. Maybe I should go as fast as I can with the time I have on another laptop, just recovering what I could get through OneDrive. But the most important thing is we would discuss, okay? I don't claim to know everything. I believe this is a mentorship hub. One of the hallmarks of this kind of forum is that I would present the issues and then we can bring in our experiences. I hope that's allowed, and our own perspectives, and we can all leave this place better for it. 30-45 minutes. I would just go through what I have here. Okay, thank you very much. And once again, welcome. So I would, I had to pull up something I've worked on in the past, but try to just polish it up a bit so that we could have something. I'm sure we are all familiar with the concept of udder health. What you have, the picture you have in front of you is focused on the udder of the cow, which is the milk production factory of a cow. It is the largest milk production factory in existence, this udder, all right? And bovine mastitis is the most costly disease affecting the bovine udder, all right, or affecting the cow. Generally, it is the most costly disease. And that's why it's important that we discuss it today. I wish I had time to discuss a number of things that would give us a better background, but I want us to focus on the subject matter of the day. And I want to imagine that we already have quite a lot of this information already. Okay, so I just want to, I don't know if we can have some kind of exercise. Like I said, I'm far more familiar with Zoom and Google Meets. I'm not very, very familiar with Teams, and I'm having to do this through my browser. So I imagine that I'm a bit limited in what I can do. But you see a number of pictures on the screen. I don't know if you guys have seen this slide before, because I think as my slides have become a little bit popular, a couple of people have used them, here and there. But which of these conditions?
It's moving.
Sorry, my slide's not moving. Oh, I'm on slide number 2. What slide do you see?
The first one.
Oh no. So let me stop and share again. Maybe. Maybe I should share my screen instead of a window. Right? If I share my screen, it might work better, so that I also know what's going on. Okay, so can you see my screen now?
Yes, we can.
Okay, so these are the disease conditions. I don't know how I can get feedback. I'm feeling kind of blind right now because is the comment section open or something?
Yes, there's a chat box.
Okay. So if we number these conditions from the left to the right, from the top left, number 1, then the middle one, number 2, and then number 3 to the far right, and then the one on the left below, number 4 and number 5. Can we vote for which one is most likely mastitis? Very quickly, everybody.
So you can use the chat box to respond, please.
Yes, so everyone, please use the chat bot to respond. And while we're doing that, I would quickly I think I need to back up a bit to say that mastitis simply stands for inflammation of the udder, okay? Inflammation of the mammary glands of the cow. Okay, I'm sure we'll get to that. But do we have responses yet? I'm trying not to take my own screen away so that I think what I would do is Doug, let me attempt to join with another device.
All right, go ahead.
Okay. So that I can at least look at what's going on with the chat box. Okay. So do we have responses yet?
Hello, audience. Are you hearing us at all? Confirm if you can hear us. Or if you have any difficulty, let us know.
Yes, we can hear you, sir.
Okay. Are you hearing him? He said if you can choose anyone that is mastitis, you can type in
So
the chat.
so number one is top left. Number two is top middle. Number three is the one to the right on top. And then number four is lower left. Number five will be lower right. Okay, so let's try and respond quickly.
Okay, so we've got some responses.
Okay.
Dr. Linda says 5. Spouse
Okay.
said 2, 4.
Okay.
Then one particular person said 2, 1, 2, and 5.
1, 2, and 5. Okay.
Yes.
Are all mastitis. Okay. Okay, that's good. So let's take a poll. How many say 1? Only 1?
Okay, so there's one person that said 1.
Okay. How many say 2?
2 said, just 2 of them said 2.
Okay, and then I believe the only other one we have is 5, right?
We have 2, 5, and 1, 4.
Okay. 2 5s and 1 4. So it means that the 5s and the 4, I mean the 5s and the 2 are complete. They have 2 each.
Yes.
Okay.
Another one just
Okay. What did they vote for?
5.
Oh, 5. Okay. Is anyone still voting?
Let's wait for them.
Okay.
We have another 2.
Another 2. Okay. Can you let me in, please? I think my other device is requesting to come in.
All right. Okay, I guess we are in now. You can unmute and continue, please. You're muted.
Okay, can you hear me now? And,
I think the other device is echoing.
All right. Can you hear me now?
Yes, we can. Go ahead.
Okay.
Yes, sir.
No more echoes, I hope.
No echo yet.
Okay, good. Okay, so let's go back. All right, so can we see the screen now? So we see which one is mastitis. Number 2 is mastitis. Okay, I understand, and I get this often, that people tend to think that number 5 is mastitis because of how swollen and engorged the udder there looks. But this condition is called udder edema. It's a condition where the vein that should be returning blood to the heart is compromised. And as a result, there is retention of fluid in the udder area. Okay. Like we say, and which is very important to know, the blood flow, the blood supply to the udder, and the blood, activity around the udder is very, very immense. All right. Because to produce 1 liter of blood, you would need between 400 to 500 liters to produce 1 liter of milk, I apologize. To produce 1 liter of milk, you would need between 400 to 500 liters of blood to pass through the udder. So if you do not have the udder draining properly, then there's going to be a big problem very quickly. And that's what you have in this condition of udder edema, which is number 5 here. Okay. The other thing to note is that the structure of the udder is such that every quarter is independent of the other. So when there's a disease condition affecting one quarter, the quarter right next to it can be completely free from it because there's no communication between the quarters. All right. So mastitis is usually affecting, one quarter at a time. Okay. Multiple quarters can be affected, and very often you will find that multiple quarters are affected, but it's also very often to find one quarter affected and other quarters unaffected, or 2 quarters out of 4, or 3 out of 4, whatever the case may be. In this case, we have the left hind quarter affected and the right hind quarter unaffected. Right, so that is how it looks. Okay, I know that we're just laying a foundation for mastitis. I don't think we need to talk much about this, but inflammatory reaction of the udder, and it is mostly caused by bacteria. Okay, like we know, bacteria is not the only thing that causes inflammation, but in most cases of mastitis, 95% of the time actually, bacteria is the reason for mastitis. And it's a very simple process of infection. When bacteria gets the opportunity to penetrate the udder, there is infection. And when there is infection, there is an inflammatory reaction. All right. So at the teeth end, this is usually the route through which the bacteria goes in, the teeth end. And then when it goes in, it gets into the sensitive tissue of the mammary glands and they get inflamed as a result. Okay, so I hope we're following up till now. All right, mastitis has two major manifestations. There's a reason why we have to go through this. So by the time we start talking about the impacts and the cost implications of mastitis, it will be very clear to us. On the left side, we have what clinical mastitis looks like. On the right side, we have what subclinical mastitis looks like. All right, clinical mastitis is what you see on the animal without diagnostic equipment. Okay, so what you can on physical examination observe is what we have on the left side of our screen. Okay, so we have changes in the milk usually first, and that's what you have on the lower side. So you have clotting, you have flakes, you have discoloration of the milk. All right, those are signs of mastitis. And discoloration can also include the presence of blood in the milk, all right, giving the milk a pinkish or reddish or even brownish tinge sometimes where mastitis is present. And then you also have changes in the udder, which are the typical signs of inflammation. So on this side, you can see that there's the same kind of situation as we had on the previous slide. The left hind quarter is affected by mastitis. And what we can see is that we can tell that it is swollen, it is reddish, all right? You can almost tell by intuition that it will be painful to touch, right? What is another, just to be sure that we're all following, what is another sign of inflammation that we have not mentioned? There are 5 signs of inflammation. Can we have them quickly in the comments? This is a mentorship session, so it should be interactive, I believe. Okay, so quickly.
You can unmute and answer.
All right, loss of function. Okay, you can also unmute. Yeah. So someone has said loss of function. So what would be the last one that we haven't mentioned? And even if we mentioned one before and you're not sure you heard it, just write what you know as signs of inflammation that could be observed on the udder of a cow in a case of clinical mastitis. Okay, everyone seems to be quiet.
Hello, sir.
Yes, please.
Okay, I think it should also be warm on touch.
Warm on touch. Okay, so heat, right? Heat to touch or warm to touch. That's good. Okay, so we mentioned all 5 of them now. All right, so swelling, pain, reddening, warm to touch, like the doc has said, and loss of function. Okay, so those are the signs that you will find on the udder or when you have clinical mastitis. Now, if you flip over to the other side, our right side, subclinical mastitis, you'd find out that the cows look perfect and the milk looks perfect. The udder looks perfect, the milk looks perfect. That is to say that subclinical mastitis cannot be observed without diagnostic equipment. All right, the milk looks perfectly normal. The cows look perfectly normal. All right, so there's no changes in the milk, no changes in the udder, only by diagnosis. Now, if we go a little deeper into clinical mastitis, you would see that we just have this table that shows that there are different forms of clinical mastitis. There's a mild form, there's a moderate form, and there's a severe. Okay? And in every case of clinical mastitis, there are certain changes to the milk that you would see. If it's clinical mastitis, there would be the formation of flakes and clots in the blood. All right, you may or may not see that the blood, sorry, not blood, the milk. I keep saying blood, but please, the milk. All right, then there will be flakes, there will be clots in the milk. There may or may not be, a watery, you may not see wateriness of the milk. You may not see blood in the milk. All right, but there will be flakes and there will be clots if it's clinical mastitis. All right. So sometimes you may not see any change in the quota. If it's a mild form of clinical mastitis, there will be no change in the quota, but there will be changes in the milk. All right. If it's moderate form, you would see changes in the quota. All right. Swelling, firm. All right. Pain. All right. It being swollen would make it firm. Right. And then when you have a severe form of mastitis, you would see an elevated body temperature. All right, which means that the infection has gone systemic. It's no more just localized to the udder. All right, let's go quickly. Like we said, subclinical mastitis cannot be seen with the eyes. You need diagnostic equipment. All right, and the diagnosis, just jump down here to only diagnose by testing. All right, diagnosis is by bacterial culture and isolation of mastitis causing organisms. And then you have increased somatic cell counts in the milk. All right. So somatic cell counts are basically primarily inflammatory cells and every other somatic cell that can be found in the milk. All right. And then there are other newer methods. Okay. Sorry, I think good. So there's no need for us to dwell too much on this. This diagram simply shows us, okay, that mastitis, cows can be in any of these states at any time. Non-infected quarters, okay, and maybe I should back up a bit. I'm sorry that I'm, rushing and it's making me not sound as coordinated as it should be, all right? But you see, cow mastitis is diagnosed at the quarter level because, like we said, every quarter is independent, right, in the cow. So we do mastitis diagnosis at the quarter level, okay? And everything about mastitis is at the quarter level. Even the treatments are usually at the quarter level, except you have a severe form of mastitis where the infection has gone systemic, and then you would need to do systemic treatments. But ideally, mastitis at the quarter level. So any quarter on a cow can be in any of these states at any time. It could be non-infected, could be subclinically infected, or clinically infected. And as you can see, with or without treatment, there can be spontaneous recovery. Okay? So there can be a spontaneous movement from any state to another state. And it's important that you note, because this tells us, how to go about handling mastitis cases. Okay, because we're here to discuss the economic implications of mastitis. All right, and as vets, it's important to note that our job is to help the farmers to save money. Am I right? I believe I'm right. All right, if you are always if every visit of the vet is costing the farmer so much money every time, and it's money that he's not making, our chances of coming back to handle cases for that family, for that farmer, will be reducing again and again. Okay, so when a cow has clinical mastitis, for example, if we start from the far right, by treatment, there could be a remission to subclinical mastitis, where the changes that were observed in the udder or in the milk disappear. But if you test the milk by diagnostic systems that we've talked about, either by bacterial culture and isolation, you might still find some bacteria there, all right, even after treatment. And if you do a somatic cell count test, like the California mastitis test, you could find a positive quota or the other, but the milk will look normal, the quota will look normal, okay? But apart from that remission, you could also have a total recovery to a non-infected state. Okay. Now, at a lower frequency, much lower frequency, like we said, there could be spontaneous recovery of these quarters. All right. Even though this spontaneous recovery is more frequent between the non-infected and subclinically infected states. Usually, when a quarter has become clinically infected, it will be almost impossible to have that quarter completely recover to non-infected states. The probability is extremely low. Okay, so the severity of mastitis is dependent on the type of bacteria that is infecting the cows. Okay, the immunity of the cow, that's its ability to resist infection or to curtail infection. And the third one is the infection pressure, all right, which refers to the permit me to say dosage, all right, or the intensity of the accumulation of infecting bacteria or whatever, or contaminating bacteria that have invaded the environment, if it's coming from the environment, or that is coming from another cow, if it's a contagious situation. All right. So there are different kinds of pathogens that cause mastitis. Some are more severe than others. Some are more harmful than others, but we won't talk about them today, okay? For now, we can just know that the bacteria that infect cows could be gram-positive or gram-negative, which is very important actually to note, because that's the reason why we need diagnosis, right? We have to go after, the bacteria that are present in the infection. And that's because if we are using agents that are active only against gram-positive organisms, whereas we're dealing with a gram-negative situation, we're not going to be able to achieve remission or recovery. All right, so based on the damage they cause to the animals, they could be major pathogens or minor pathogens. And finally, based on their ecology or epidemiology, in other words, how they are transmitted or how they are acquired by cows, they could be contagious pathogens or environmental pathogens. Contagious pathogens, I'm jumping. Let me see. Yes, let's just jump. Contagious pathogens go from one quarter to another quarter, either on the same animal or on different animals. Okay, so contagious pathogens could be staph aureus, strep agalactiae, mycoplasma species. These are the most common contagious pathogens, while environmental pathogens come from the environment of the cows, all right, and sometimes we call them opportunistic organisms, all right, because when the udder is compromised, either by the teeth being open or by trauma or whatever, then these organisms are able to find their way into the sensitive tissues of the mastitis, of the mammary glands, and cause mastitis. Are you following me so far, please? Give me some encouragement. I feel like I'm talking to myself sometimes when I'm doing a webinar. So just in the comments, just say I'm following. And at any point in time, because this is not just a webinar, this is a mentorship session, feel free to ask questions. All right, if you're getting confused at any point, just feel free to ask any question. I'm happy to stop and attend to questions. All right, just put the questions in the comment section. That's the point. I will check in from time to time. So now we've talked about all this. Let's come to what has brought us here today, which is the implications of mastitis. All right, and when we talk implications boil down to costs. They boil down to naira and kobo. All right, many times I tell my students that the major difference between a vet and a human medic is the fact that when it comes to health problems with human beings is not usually considered as a financial problem primarily. It's considered more, all right, as in an emotional kind of way. All right. People don't think so much about finances, and I know that this is not absolutely true, but if people have money to treat themselves, usually they would treat themselves without overly considering the cost. But when you have diseases in animals, it is usually primarily an economic challenge, and the decision around managing any disease with livestock especially are economic decisions. So when we are talking about impacts, the most important thing is for us to look at the cost implications. And that's why we'll go straight to this slide and discuss these slides. So as you can see, we have 12 of these economic impacts or cost implications of bovine mastitis, and we'll take them one after the other. All right. We would go into them as much as possible and just discuss them. Okay, and then we will open up the floor for more discussions as we go. And we'll also see if we are able to do an exercise like we've done in the past when we consider these things. Now, the first one is decreased milk production or decreased milk volume. The next one is discarded milk due to hygiene or drug residues in the milk. Right. The next one is disease spread to other cows or other quarters. The next one now is decreased milk quality and salability. Next one is immune suppression leading to comorbidity. And then next one is cost of veterinary services. Next is cost of veterinary medicines. Next is cost of diagnostic tests. Next is mortality or culling of animals. The next, decreased fecundity. And the last two are man-hours dedicated to control measures and cost of management and man-hours in human, or cost of disease management in humans. That last one can also be called that. So we will come back to all of them. Okay. So this slide speaks to the first one, decreased milk production volume. Okay. When you have a case of mastitis, whether it's clinical mastitis or subclinical mastitis, there is always a reduction in milk production. All right. Mastitis is inflammation. Okay. Is inflammation of the mammary glands, which means that there is a degree of loss of function, whether it's at the level where you can see it with your physical eyes or is at the level that you cannot see it with your physical eyes. Okay, so I want you to take a look at this graph here. Okay, the topmost line that has black dots. All right, this topmost line, if you follow it down to where it is reduced to just dashes, this line is the potential milk production capacity of this particular cow. Okay, so this cow, if it had no interruptions, this is how its lactation curve, this graph is actually called the lactation curve. This is how its lactation curve would have gone. All right, on the left side here, you have the daily milk yield. So we are following this, week by week by week, every week, points for every week. This is how its milk production would have been. Okay, that's potential. Okay, now for a normal healthy cow, okay, this is a high milk producer going like this, potential. A normal healthy cow will most likely produce at the level of the line that has boxes, open boxes like this. That's normal average milk production of a cow. Now, this generic here shows a situation where you have episodes of clinical mastitis. So clinical mastitis usually targets cows that are high producing, all right, cows that have the potential to produce a lot of milk or higher milk than average, because the activity in the udder, the activity of the secretory cells of the udder, those cells or those units of milk production there are called alveoli. All right, so the activities in the alveoli of higher milk producing cows are actually higher, all right, more intense. And so if an infection goes in there, it's more devastating than when a cow is less, has less potential for milk production. So this cow started out very well, and then clinical mastitis hits it at this first point. I'm hoping that you're seeing my pointer. So it hits it here, and then milk production drops abruptly, very low. And then there's treatment or some kind of intervention, and then this cow recovers. But notice that the cow does not recover to its potential. It recovers to the average or even below the average. And it's just getting there when it has another episode of mastitis again that drops its milk production, and then intervention is instituted, but then it goes, and then as soon as it's about, it's trying to stabilize around, the average milk production of the herd, but then it's hit again, and then after recovery this time, it pretty much just stays around the average milk production of the herd. So it never, from the first time it's hit with mastitis, it never returns to its potential, all right? And so this drop in the milk production potential is one of the major challenges that we consider as a cost implication with mastitis. And many times people consider only this, okay? Because you see, the difference in milk production for this cow is the difference between this dotted line or this dashed line, which represents its potential, and all these falls in milk production. So all of this space that you see here between that dotted line and this line with this dashed line and this line with big black dots, as points, is the wasted or the lost milk. We call it milk yield loss. Okay, so this is the first way that mastitis impacts milk production. It greatly reduces our milk production potential of our cows so that we don't see what's going on. Now, I want to use this same graph to illustrate a situation where you have subclinical mastitis. As we will see later, subclinical mastitis also drops milk production, but it's not usually as obvious as you have in clinical mastitis. Okay, so what would happen usually to a cow like this that has subclinical mastitis is that it will drop the milk production to somewhere around this line with boxes, all right? And because it goes unnoticed, there's no physical change in the milk, there's no physical change in the udder. So the farmer is not aware that anything is going on with the cow. It just reduces that milk production potential, and there becomes a huge gap, and mastitis can stay there for 1 month, 2 months. It can sometimes even last the entire lactation without it reverting, to normalcy. And so, and even when it reverts to normalcy, even when the milk is free of excessive somatic cells, or the milk is, whatever the changes, have been reversed, the changes that can be identified in subclinical mastitis, by testing, when they've been reversed, there's no more bacteria there, the likelihood that milk production will return to normal is very low. So you can look at that as the difference between these two lines, the dotted line, right, and the line with open boxes. We can take that to illustrate to us what subclinical mastitis would do in producing losses in milk yield. Are we still following? So that's the first one, okay? And many times this is all we know about milk production, but milk production losses or impacts of mastitis. But you see, that's just 1 out of 12, okay? We would save this costs of a case of mastitis. I would come back to this a bit later when we go over the others, okay? And then we'll discuss them because they cover more than just what this slide is saying. The next thing, all right, I will move faster now, is called discarded milk. And milk is discarded usually for 2 reasons. The first reason would be hygiene, all right, hygiene concerns. Why would we discard milk for hygienic reasons in a case of mastitis? Can we have comments, please? Let's prove that we're following. Why will we discard milk? Okay, someone says color change prevents spread of zoonotic diseases. Okay. Okay. That's good. Anyone else? Anyone else? Should I call out names? I'm trying to see the list. Okay. Okay, at least we have 2 responses, and they are very valid responses. Okay, so someone says color change, but why would the color change? It's because there's some form of deterioration, right? You see, so that's a hygienic concern or a hygiene concern. And then, of course, to prevent the spread of zoonotic diseases. Okay, and that's assuming that the infecting bacteria has the potential to cause problems for human beings, which is also a hygienic reason. All right. But are there concerns also with respect to antimicrobial resistance, AMR, as a result of drug residues in the milk?
Yes.
Okay, thank you very much. All right, so when we treat, as vets, we know that there's a withdrawal period for every drug, right? And usually, when you treat for mastitis, you go for the order. You want to have a localized, highly impactful treatment. So it means that the milk would be exposed to antimicrobial agents that is being treated with, and that's not safe for human consumption. And so there's discarding of milk for the period of treatment, as well as the period that is designated by the manufacturing company as withdrawal period. Okay, so withdrawal period begins after treatment ends, after the last treatment, not on the first day of treatment. So if I'm treating for 5 days, all right, I start discarding milk from day 1 of treatment, from the moment that I put in my antibiotic, and then I start counting my withdrawal period. If it's 3 days, 5 days, 7 days, from the day of last treatment, from day 5. So you can imagine that if a drug has a 7-day withdrawal period for milk, and I'm treating for 5 days with that antibiotic, how many days would that be for discarding milk? Let's answer, please. You can unmute and answer very quickly. I've seen that we're not, I thought we were quite many on the call, but we're not so many, so we can even just have a discussion. Unmute. Did you hear my question?
So repeat the question.
Okay. I said, if, for instance, you have a case of mastitis, right? And the drug you have chosen requires you to treat the animal for 5 days. And the withdrawal period for the drug from milk is 7 days. How long would you need to be discarding milk? For how many days would you need to be discarding milk? Because of drug residues in milk. I didn't hear that, please. I heard someone speak, but I didn't hear what they said.
7 days. 7
Sorry?
days.
You said 7 days. Someone said
Yes.
7 days. We have someone else. Someone has said 7 days. Do we have anything in the comment section? Someone says 7. Someone says 14 days. Okay. Any other opinions? Okay. Just because of time, it's actually 12 days. Okay, because you count the 5 days of treatment, and then on the 5th day, you start counting 7 days. So 5 plus 7 is 12 days, okay, of discarding milk. Now, assume that your cow is producing, let's say, 10 liters of milk a day, okay? And you're going to discard milk, all the milk that she's producing for 12 days. That's the 120 liters of milk. Are you following what I'm saying now? Okay. So if she's losing, you are losing, not just her now. You are losing 120 liters of milk for treating one case of mastitis. Okay. Over a 12-day period. How much is a liter of milk now? Who can give us a current price for 1 liter of milk in your location or around you? I imagine that some of us are active in the field. Who's answering for us? You can do the comment section or however you would prefer. How much is a liter of milk? No answer. Okay. Okay, so 1,000 to 1,500. Okay, good. So let's just take the lower limit, right? 1,000. Multiply 1,000 by 120. How much is that? That's 120,000 naira in 12 days. All right. So you have an idea of what discarding milk is costing us. Okay. I know that in many quarters, dairy farmers are not discarding milk, right? But that's not safe at all. Because you see, apart from the hygiene, factor, the scare of zoonosis, we would say, oh, we'll pasteurize the milk. That's okay. But you see, the milk is actually not of good quality anymore because some of the infecting organisms can cause spoilage. Okay. So the nutritional quality of the milk is compromised, apart from the zoonotic, scare. And then the drug residues in the milk, apart from the fact that they can cause antimicrobial resistance in humans, they will also affect the processing quality of that milk. If you have antibiotics in milk and you want to use that milk to form yogurt, do you think it will be easy for you to
We're not hearing you, sir.
You said you're not hearing me?
Yes, sir.
Now we're hearing, but it's echoing.
Okay, someone was calling somewhere. But that wasn't me. Okay, can you see my screen?
Yes, sir.
Okay. So I asked a question, please. And I want a response. Okay. And my question is simple. How would residues in milk, drug residues in milk, affect milk product processing, the processing of milk products? Like yogurt or cheese? Do we think, how would it affect? I want someone to speak, someone who wants to speak. I don't just want a comment in the box. Please unmute and speak.
Yes, sir. In the making of some of these milk products, you need
Yes.
bacteria for fermentation process. So
Right.
I think with antibiotics will affect that.
Yes, so the antibiotics will do what?
Will kill the the bacteria necessary needed for
Yeah,
the fermentation.
very, very true. Does any of us know any of the bacteria that's involved with fermentation for example, yogurt production? Anybody? I'm just trying to find out if there's any of us in that field. It's not an academic question. It's not a grading. Okay. Okay, so I'm not seeing anybody talking very quickly, which means that we might not be too familiar with that. But you find out that the bacteria that are used for processing milk into products are usually very fragile bacteria. Okay, so if you have milk that has any drug residues in it, it will not allow your products to come out. Okay, that's why some of us have tried to make yogurt out of, powdered milk before, and we were not able. There was no cord formation. Our yogurt was not just happening, and we're wondering what's going on. What am I missing here and there? It's sometimes because there are antimicrobial products in some of these powdered milk, products. They put them as preservatives, and so they will not allow the fermentation process to go as handled. And that's why, this is also a major challenge, that even if we don't discard milk like this, we would also struggle with getting our milk products out of the milk. Okay, even if we have no ethical values, all right, we are not concerned about zoonosis, we're not concerned about the nutritional value of the milk, we will also go and hang in the area of converting this milk to products. So that's why discarded milk is a very important impact and economic impact of mastitis. Are we following? I hope this is making sense. Okay.
Yes.
The next thing is that there's disease spread to other quarters and other cows. All right. And I just put a picture here of how diseases spread in a farm. All right. You have the cow there in the center, and any of these things here are challenges that can present or introduce mastitis to a healthy cow, right? Environmental pathogens will come through bedding material, okay? So if the environment of the cow where she sleeps is contaminated all the time, like we have in most of our herds, go to most of our herds, the cows stay inside their feces. They live right there. Okay, there's no form of hygiene, pretty much. We only try to reduce, the density of the fecal material. But as for hygiene, for where the cows live and sleep and all that, there is no little or no consideration. And so our cows are very exposed to environmental pathogens. Right? Flies also in an environment can also, this is feces, all right? They perch on feces, which is a very good medium for growth of bacteria and all of that. And then they take these parts of their body, and the next place that they're very eager to go to is the teats, because the teats have residues of milk on it and it attracts them. So they are going there and they're transferring bacterial organisms between, the environment and the teeth, bringing the teeth in close proximity with infecting organisms. All right. Next, you have the milker's hands. Okay. If you notice, on most of our farms, our milkers do not wash their hands in between milkings. Okay. So they milk one cow, they push it away, they bring the next cow, they're milking immediately. All right. And if one cow, the previous cow had mastitis and the organisms have contaminated the hands of the milker, he will just transfer those organisms to the next cow. Right. Many times the milkers are even touching different things. They are cleaning the kata on their nose. They are even using their saliva sometimes to lubricate their hands. I've seen a situation, where they put their hands in wet feces to lubricate their hands for milking. Some of us who are in the field have seen this before. Am I right? We have seen some of these malpractices before, and that's how sometimes we infect our cows ourselves with mastitis causing organisms. Okay. There's cross suckling as well, right? Where one calf suckles from one cow that has mastitis and takes that same mouth to suckle from another cow. All right. And then milking machines also. In our farms where we have milking machines, many times we don't disinfect our machines between, milking cows, especially during the same batch of milking. Okay. For example, if we are milking in the morning, we have sterilized the previous day or something, and then we come and we just rinse the milking cusps, we attach them, we collect our milk for the first batch. As they go away, we just attach the same cusps to the milking units, we attach them to the next batch of animals, and by so doing, mastitis is being transferred. All right, so we've gone through all this. Why is there a cost implication attached to this? Once mastitis is introduced into your farm, except you are extremely careful, except you know how to manage mastitis very well or manage your head health very well, it is almost impossible to prevent those mastitis organisms from spreading because of the ease with which mastitis can move from one cow to the other, either through the environmental route or through direct, contagious transmission, all right, either through milking machines or through cross-suckling or through the milker's hands. Okay, so it's a cost implication because once it is introduced, the likelihood is that it will spread. Okay, and that's the implication. Okay, if there's any questions, I'm trying not to waste too much time in trying to explain things. I'm usually better if I'm seeing people, but as it is, I'm pretty blind right now. Next is that there's decreased milk quality and sellability. As you can see, there are color changes in the milk. All right. If you notice the picture I have here, none of these two milk samples are the proper color, right? The one on the left looks diluted, and that's a change that can occur. The one on the right looks on its way towards fermentation, all right? So that's the problem. There are changes in the color of the milk, all right, with mastitis. There are changes in its quality, all right? Milk is ideally sold on the basis of its quality, all right? In many developed countries, it's the fat content of milk that determines the price of the milk. Okay, so milk, there's no flat rate per se. But if milk has a higher fat content, because you see, there are many products like cheese, like butter, that are dependent on the fat content of milk, and of course the creaminess of fat content as well. And so when that is compromised, the price of the milk will drop, and that is an impact. That's a cost implication. I hope you get that. Can I have some responses? Say yes, I do.
Yes, sir.
Thank you very much. Next is immune suppression leading to comorbidity. All right. So the thing with mastitis is that mastitis is ranked amongst what we call periparturient diseases. That is, diseases that occur in or around the period of parturition. Okay, in or around the period of parturition. All right, and around that time, there's a generalized kind of immunosuppression. Why? Because of the pressure that is on the cow due to I'm trying to look for a simple word to use. Well, but you see, parturition is a very stressful process. Giving birth is a stressful process. Okay, and so around that time, because of the stress associated with parturition, there are a lot of health issues that could rise up. All right, and once there is mastitis, all right, it also fuels a number of these other issues. I'm trying to get. Okay, I think I can hide this. Oh, great. You see, so once you have mastitis, you are prone to having what is called ketosis. Okay, and then that will also lead to reproductive disorders. That will lead to all kinds of things. Okay, it's associated with a number of these periparturient, even displaced abomasum, all right, so on and so forth. All right, there are quite a number of periparturient diseases, all right, and these are comorbidities that could arise as a result of the presence of mastitis. So what we are saying is that it's an economic problem because the presence of mastitis can introduce or lead to other problems that are not directly related to mastitis in control or in treatment, which means that in managing mastitis alone, you would not take care of all the issues that mastitis has caused. You would have to take care of a few other issues as a result of the issue that mastitis has, the primary issues that mastitis has caused, like reduction in milk production, so on and so forth. There will be other diseases that will be introduced and other treatments that will be needed. Okay. Next one here is cost of veterinary services. Okay, we are almost there. I believe we've gone beyond halfway now. All right. Impacts of mastitis include cost of veterinary services. I believe most of us, if not all of us on this call, are vets, right? And I want to ask you a question. Please, if you are invited to treat animals, how often do you go for free? Thank you for the question. I appreciate the question. We would take care of it. Please, like I said, I'd like us to have questions. Okay. So thank you. I believe this will be Dr. Mohammed I. How many of us go to treat cases for free? Vets. I'm talking to the vets in the house. I chose this picture.
Except for a few.
You said?
I said we don't usually go to treat animals for free, except for a few unavoidable cases where you just manage the case and you don't really charge based on relationship or something. But most of the time you have to place charges on what you are doing.
Yeah, that's correct. Okay, and the busier you get as a vet, the less you are likely, the busier and the better you get as a vet, the less likely you are to go anywhere for free. If it's not worth your while, you're not going to show up there. You know, this is a ethereal group. So I chose a ethereal picture here. Okay, this is not related to managing mastitis. Okay, but it's just that veterinary services cost money. Okay, we choose, we charge at different levels. Okay, we charge at least, first of all, for transportation. Somebody said, no way. Yes, no way. After a while, you just stop going for anything that will not translate to money in your pocket. Okay, while you're starting out, it's important that you use it to get experience and all of that. But after a while, by the time you have so many bills to pay and all of that, you will start dodging them. Okay. Somebody says at least for drugs and consumables. This is apart from drugs and consumables. This is for your services. Okay. You should charge for your services. Okay. Every vet should charge for their services. You did not go to school to sell drugs. No, you went to school for diagnosis and treatment primarily. Okay. And then of course, consultation, which is beyond diagnosis and treatment, okay, which is establishing health systems, and all of that. Okay, so you must charge for services. If you're unable to charge for services, if you're having to only go through, drugs and consumables, then you're not a vet yet. Do you understand? You're not charging as a vet. You are doing what any quack out there should do. But as a vet, we should be able to charge for services, okay? Which is house call, okay, which is transportation to take us there, and our time spent in consulting. Okay, some of us, well, let's leave that for now. That's class for another day. Okay, this is a mentorship class, so we need to call it spade a spade. Okay, so there's cost of veterinary services. From the perspective of the farmer, it's going to cost him something to invite a vet, and that's an impact, an implication. All right, for a vet to be able to come and diagnose what the problem is and then develop a course of action or a course of intervention. All right, then we come to cost of veterinary medicines, all right, and consumables, like Dr. Mohammed K has mentioned here. Okay, we have two major drugs in the market. The Zoetis representative was mentioning to me, I was trying to find out the actual costs of these drugs, and it's not giving me the actual current costs, but it's also telling me that they have a few other drugs in the market right now. Okay, and the one on the left is called Sinulox LC. Sorry for the picture quality of the one on the right, but I'm hoping that you can still see it a little bit clearly. Sinulox LC is for treating mastitis during lactation. All right, during lactation. This is 12 syringes, okay? We have 12 syringes preloaded with Sinulox LC, all right? And Sinulox LC is a combination of amoxicillin, clavulanic acid, and prednisolone, all right? An anti-inflammatory, gram-positive and gram-negative antibiotic agent to be able, so it's broad spectrum, all right, and it takes care also of the inflammation. So this is during lactation, and it has a shorter withdrawal period and treatment period than most, probably all the other mastitis lactation, drugs that we have available. That's drugs that you can use to treat mastitis in the course of lactation. Now, the one on the left is Spectramas DC. It's a dry cow formula. And dry cow, meaning when the animal is not lactating, is when we can use this drug to treat. Okay, so for example, the withdrawal period for Sinulox LC is 84 hours. 84 hours, okay? So that's just is 3.5 days withdrawal period, all right? And the expected treatment is 1.5 days. So it's 3 syringes per quarter that you will give in 12-hour intervals. That's Sinulox LC. Okay, so you give it 12 hours intervals, that's 36 hours. That's 1 day and a half. Okay, and then you count another 84 hours. So that's the entire period that is liable for withdrawal. Okay, I hope we are following. Is this making sense? That's for lactation. But for spectrum DC, which is a dry cow formula, you inject this into a cow that has been dried off. That means you have stopped milking this animal, all right, and you are probably preparing the animal for her next lactation. So she should be anywhere between 7 months and, let's say, 8.5 months pregnant. Okay, those are the kinds of cows that you are giving Spectramast DC. All right, and Spectramast DC has a withdrawal period of at least 30 days, if I'm correct. It's not less than 30 days withdrawal period. All right, so that's why you don't give Spectramast DC during lactation, because you see, we did a little calculation earlier. Okay, for Sinelox LC, you're going to discard milk for how many days? 1.5 days plus 3.5 days is 5 days in all, right? If your cow is producing 10 liters of milk on average a day, that's 50 liters, right? If you use 1,000 as the price of milk, that's 50,000 naira is what you're going to lose in just discarding milk due to the treatment. All right, but now imagine you make the mistake of treating with Spectramast DC and you're a good person who wants to observe milk withdrawal period. If you treat a lactating animal with Spectramast DC, then you have to wait for how long? 30 days. All right, for a cow that's producing 10 liters of milk a day, we don't make that mistake, right? Because now that is 30 days times 10 liters is 300 liters, all right, times 1,000 naira. You don't want to make that kind of mistake and incur that kind of loss. So we only give this as a dry cow formula during the dry period when a cow is not lactating. Okay, so these are costs because the drugs are expensive. Okay, they are not cheap. Most of us as vets usually have not encountered intramammary infusions. Right, what we do many times is that when we have mastitis cases, or well, can we just even have a conversation about this? How many of us have had mastitis cases before? You've handled the mastitis case. Do we have anybody? Can we respond very quickly? And I want a conversation if it's possible, not just a chat. So if you handle a mastitis case, can you unmute yourself and let's know how you handled it? This is a safe zone and we're not assessing anybody. This is not an exam. This is not oral exam. This is nothing. We're just discussing our realities as vets and what the ideal situation can be. So is anybody willing to share their experience with us? I'm not hearing anybody saying anything. Well, it's okay. Well, usually what we do is that we convert 18 gauge syringes, into intramammary tubes or intramammary what now? Needles. Needle is not even supposed to be associated with the mammary gland, okay? Because when you use a needle, the chances are that you will traumatize the gland. You will traumatize it at some point. You will traumatize some parts of the odor, which is completely wrong. Okay, so my whole point in saying this is that treat any intramammary infusion you're going to use is quite expensive. Okay, I know that a pack of Sinelox LC, as the last time I knew the price, which was sometime in December last year, it was somewhere around 36,000 or so. All right, for a pack of 12 syringes, and you will need 3 syringes for one treatment, 1/4. Okay, so that 12 syringes there is, if you have a cow that all 4 quarters have mastitis, then you would need to use the entire pack in treating only one cow. Okay, but there have been increases in the price of dollar, so on and so forth. So they are quite expensive drugs. Okay, so apart from veterinary services, the cost of medicines is also a very important item of discussion. All right, I think I'm going a bit too long now, so we would rush through the rest. Okay, and I don't even have pictures for this. Like I said, you would pardon me, I had a problem. My computer just refused to boot, so I just had to save what I could using OneDrive and going to another computer. All right, so I've lost some of my information, but it will help us not to waste time. Okay, so diagnostic tests, we have different diagnostic tests possible for mastitis, but all of them cost money. All right, if you try to do isolation and identification, culture, isolation, and identification from a milk sample in any place, in any lab, it's going to cost you some good money. Okay, it's going to cost you at least the very least I know right now for an insider will be something like 500 naira per sample per test. Okay, but I don't think that's even for culture and isolation. No, culture and isolation per organism, okay, would be something like 1,000 naira, okay, per sample per organism. Okay, and then mastitis is caused by so many organisms that you would want to at least go for 3-4 organisms. Okay, so this is very important. Okay, very, very, very important to note. Tests are expensive, right? The field test that we have that is most common is called California mastitis test, right? And it also costs some money to do that. So that's very, very very important to note that the tests will all be expensive, right? So that's a cost implication or impact of mastitis. Next is mortality or culling of animals. In very rare cases, we had animals die of mastitis, right? So where there is acute sepsis, where there's a situation that the bacteria infects the blood and causes some kind of toxicity, the animals could die of sepsis that originated as a result of mastitis, right? But then what's more common is that when animals become less productive because of mastitis, all right, you are keeping the cows for the sake of milk production, and then the cow has one blind teat as a result of mastitis, which means it's no more producing milk in one teat or 2 teeth or 3 teeth. You are not keeping the cow for anything anymore. You will just cull off the cow, all right? And culling costs something, all right? Because the cost of culling includes the cost of replacing the animal that has been culled, okay? So some people say, well, it's just to salvage the animal. All right, if I salvage the animal, I'm going to get money from it. If I slaughter the animal, I'll get money from it. Yes, but what's the cost of getting another animal that will give you the potential amount of milk that this cow was supposed to be giving you? All right, that's an impact. That's something we need to think about, right? And then you have decreased fecundity. Mastitis results in a decreased fecundity. That means an increased calving interval. It becomes more difficult for the cow to conceive, right? So most of us on this call will be theriogenologists that are into artificial insemination, so on and so forth. Mastitic prone animals or animals that have mastitis will give you more problems with conception, all right? You would have to use more inseminations before they will take in. Okay, so this is important, and you know that every insemination costs money. All right, there's transport costs in going there. There's the cost of the semen, all right? There's the cost in this of the whatever hormones you are using in synchronizing the cows, so on and so forth. Okay, so it's expensive. All right, increase the impact, increase cost due to the presence of mastitis. Man is dedicated to control measures. All right. What do we mean by this? Time is money. If an animal has mastitis, you will need to take time in
So we can just hear you. Am I the only one not hearing?
would need to empty. I think there's all right. Can you hear me now? I had to go out and come back in. Can you hear me?
Yes, sir.
Okay. Thank you. Okay. Sorry, I will soon be done tormenting you. All right. Man hours dedicated to control measures. I was trying to explain that, okay, to say this, that you will need extra time to manage animals that have mastitis. And time is money. All right. So there is the opportunity cost of what you could have been doing with that time that you're using to treat mastitis. All right. Either for you as a vet or most importantly for the farmer. All right, because there are certain things that they need to do in managing a situation where they have mastitis. If there was no mastitis, that time could have been used for other more profitable activities. So that's what we mean by man hours dedicated to the control measures. And finally, the cost of management and man hours in human, or the cost of managing diseases that are transmitted to humans as a result of mastitis in animals. So this is a situation where there is a zoonotic transmission of a disease, any of the bacteria that can cause disease in humans, either E. coli, because E. coli can cause mastitis and contaminate the milk, and it can become a problem in humans. Same thing with Staphylococcus aureus or some of the streptococci organisms, and any of the other organisms of concern that could cause mastitis. Okay, with this, we have come to an end of this our list. Okay, these 12 cardinal factors that we consider as the general impacts or cost implications of mastitis. I think we can pause here and take as many questions as possible. Thank you for your attention.
Thank you very much, Dr. Paul. I'm sure everybody had a wonderful time listening to Dr. Paul. So we'd like to take some observations, questions, and comments so that will make the presentation more enlightening. So if you have any question, you can simply indicate by raising your hand. Then I will ask you to go ahead and ask the question. If you are shy and you don't want to speak, you can also type the questions in the comment section. So, Dr. Paul, I think during the course of presentation, there are
Yes,
some questions that were dropped on the chat box.
yes.
I think
There
one
was
or
one
two, I don't know.
particular question. Yes. So that was the question about, can mastitis occur at post-parturient? Okay. Yes. And the
Okay.
answer is yes. Okay. The most likely time for mastitis to occur is in the first few weeks of lactation, right? Because milk production is increasing at a rapid rate, and it's putting a lot of demand on the body of the cow. All right. So the immune status of the cow will be compromised if the nutrition is not going at par with the demand for milk production. And that will expose the animals more to mastitis. And that's, of course, post-parturient, even though it's still close to parturient. Periparturient period usually is considered to be 2 months before parturition and 1 month after parturition. Okay, so it's highest closer to parturition, but mastitis can also occur at any point in the entire course of lactation, which is any point after parturition to the all the way to the end of lactation. So my answer to that question is yes, mastitis can occur post-parturient. It's more likely at the early post-parturient period, all right, which also is sometimes covered by the periparturient duration, but it will still occur if animals are sufficiently exposed at any point in the course of the lactation. Thank you.
Thank
So
you very much. If you have any further questions, you can ask. Before then, maybe I would like to ask my own question.
Okay, please go
Since some
ahead.
of these drugs against both clinical and subclinical mastitis are expensive,
Yes.
have there been any research to explore the use of alternative medicines, like herbal drugs, for example?
Okay. So that's a very, very excellent question, and I truly like that question, and I'm hoping that we can have a good discussion around it. Yes, there are herbal drugs that have been used. The problem, though, is that, like the problem with herbal drugs up till now is that we have a challenge with knowing the consistent effects of these herbal drugs. All right, and the reason is this: these drugs are mostly used on lower milk producing animals, our local breeds, the white Fulanis, okay, the Sokoto Gudalis, which do not have mastitis as often, right, as the exotic animals. The exotic animals usually, are more often in the hands of people that will attempt to, to get these other drugs. Okay, but in all I'm saying, there are two problems we have with the herbal drugs. One is ascertaining the effects, the efficacy. The second one is in ascertaining the dosages and how to consistently use them for the results that are needed. Okay, or the results that we desire. So that's it. But then I don't have experience, with herbal drugs. I've only had conversations with farmers that use them here and there, but I've not also had the opportunity to monitor how effective they are, because the situations in which I had those conversations, the animals were not really at much risk of mastitis and did not have serious mastitis issues. This was just on the basis of research. Okay, so I would also want to know from the house and from you, sir, what your experience is with these herbal options, ethno medical options, or with the use of any other antibiotic options as well. So I'm increasing the scope of the question, more or less. So, Doc, can we hear what your experience is like? I'm seeing a number of people typing, but I'm not seeing any questions. Does anyone have experience with using herbal drugs for treating mastitis?
Hey, thanks, Doc. I I had a few experience with the use of herbal drugs. Mostly they are drugs imported from India, and most of the contents are usually not explicitly made public. So those kind of drugs are just hidden under some kind of blanket. But in terms of the usage, I've used it in I've used it in small ruminants, and they prove to be very effective. But I don't know the um the effect in large ruminants like cattle. So so I just searched, and I found out that particularly in India they have a large experience with the use of herbal remedies against mastitis, which offer a promising alternative to conventional antibiotics for treating bovine mastitis. And they mentioned quite a few. Um, peppermint, peppermint oil, which demonstrates strong
Okay.
antibacterial activity, even
Mm.
surpassing the commonly used antibiotics. So this looks promising, particularly in the face of antimicrobial resistance. So we can maybe in our various universities we can explore clinical research to see how we
Yeah.
can implement these to find the efficacy of these drugs. Another one is the thyme oil, the thyme we use for cooking.
Yes.
Oils extracted from it have also shown effectiveness against
Wow.
mastitis. We have a lot of other ones that are not, maybe we can say they are not indigenous to Africa. We have
Yeah.
Terminalia, Tibula, porcelain, Dedalium, and other extracts.
Okay.
I've also tried extracts that have effect against inflammation. So they have anti-inflammatory properties.
Yeah.
They have used them in combination with those that have antimicrobial properties.
Mm-hmm.
Interestingly, there are other plants too that have immunomodulatory potentials. So I think this is a promising field that we can explore in our universities.
Yeah.
Okay,
Yeah.
I
This
think
is
there's
this,
another question. Yes, go ahead.
no, I'm just saying that this is very, very good to know. This is very good information. Like I said, and like you have rightfully said, the challenge though is dosage, and extent. Just so that we are, for two reasons. One, every drug has a toxic potential, so that we don't cross the line and cause some problems, solve one problem and cause another problem. Then the second thing is cost effectiveness, so that we're not wasting resources when we can actually use in much less quantity, for example, to manage the situation, and then and all of that. So yes, I would take this very importantly and see if we can design something, especially for peppermint oil and thyme oil, which are available to us. Mm.
Well, that's good. We have questions from the chat box. Maybe if you can
Yes, yes, I can see.
attend to them.
Are there any drug remedies that can increase milk flow after pasteurization? Because sometimes we experience that, especially in goats, there is no even adequate milk that can feed the neonate. I think I want to throw this also to the house, because there are different things people do. Okay, but I don't know if there are drugs that can increase, milk flow. I know that the first thing a vet would tend to do in this kind of situation is to maybe see if you can stimulate more a stronger milk letdown reflex by giving oxytocin. But I also know that oxytocin has not been the most effective remedy. It has sometimes come to the rescue, but not all the time. I think it's more effective in small animals like dogs and cats. Yes, but I want to open it up. Does anybody here have experience with this, and what you did and what the effect was? Increased milk flow after pasteurization.
Okay, so interestingly, this is a common complaint we receive in clinics.
Yes.
Postpartum agalactia.
Yes.
As much as possible, we try to diagnose the actual problems. So
Okay.
more recently, I've engaged the use of the CMT to find out whether they have either clinical or subclinical
Okay.
mastitis before
Okay.
targeting the therapy.
Okay.
Traditionally, there are also herbs that are used to increase galactogenesis, ruminants particularly. One
Yeah.
of my students are working on testing like two of such plants, moringa and fenugreek, which are herbs that are commonly available in our environment, and they are used in human medicine, particularly the traditional ethno medical practices by local communities. So
Okay.
I think the take home is that before using any drug to treat agalactia, we have to trace it back to the actual cause of the agalactia. For
Right.
example, we've had cases of small ruminants presenting with foreign body rumen infarction. This either directly or indirectly affects milk production by reducing the amount of nutrients available for lactogenesis. So co-infection with parasites. Once there's anemia, you expect that the volume of milk will be lowered. As you have said earlier, to produce just 1 liter of milk, you require about 500 liters of blood. So if there's anemia, definitely this will affect the milk outcome. In addition, availability of water. Water is very important for lactating animals. So I think the normal practice of I've had some interactions with farmers that they say their own conception is that animals will only have water once in a day, and definitely this will affect the milk production from the animals.
Yeah.
So apart from that, after checking all the other factors involved, and you are sure they are okay, most likely milk letdown can also be affected by maybe insufficiency of oxytocin or stimulation by the neonates.
Yeah.
Okay, thank you.
Thank you very much. I'm
Uh-huh.
learning. I think I'm the one who is becoming the interviewer, but but I just want to buttress the fact that my approach to anything, that has to do with presentation of a condition is that we need to first start, we need to settle the nutritional indices, first. Okay, even as vets, I know that as vets, we are quick to look for a disease condition, but especially when it has to do with something that is production related, like milk, and like Dr. Babashani has said, we need to be sure that not only water is ad libitum, but they have access to nutritious feed. They have access to nutritious feed because, like we said, milk is a product of blood and it's extracting nutrients from the blood. If there's no nutrient to extract, then there's no milk to be produced, So they need to feed, you need to evaluate what they're eating, and of course, be sure that they have water at libitum, all right? And then every other thing that he has said, okay? I hope we're taking notes, actually, because these are important things to remember, all right? If they're underlying disease, causes, they need to be taken care of, okay? They definitely need to be taken care of, remain impaction, so on and so forth. Okay, I think there's another question, very interesting question, that says, what are the most cost-effective strategies for mastitis prevention in small farms, especially where access to veterinary services is limited? Okay, and even though that virtually all the questions we're asking today are out of the scope of our discussion, but is important. There are principles for mastitis prevention. Okay, and the most important ones are the fact that we need to look at our milking procedure. Okay, first of all, we need to look at our milking procedure. That's usually where the problem is, right? Milking hygiene. How are we going about milking the animals? Okay, if we are milking in a way that we are facilitating transmission of organisms from one cow to another, that's by not disinfecting our hands or washing our hands in between milkings, not disinfecting the teats, of the animals, making sure that the entire other area is clean. We're not asking for best practices, but at least let the others be washed and wiped, cleaned, all right, and disinfected. And then the hands of the milkers also washed between each cow, right? Reduce cow to cow transmission of milk. Then environmental hygiene as well, to make sure that especially their sleeping areas, their pens, the areas where they need some bedding, make sure that those places are clean. And we use some kind of bedding that can soak away moisture, right? Some places are using sand now, which is good. It's just that our environment is quite hot, so sand is quite uncomfortable, right? But sand enables that urine is drained downwards. The feces is the moisture on the feces also drains, and then you can easily remove, the top and replace the sand. So there's that hygiene that is important. Then there's also the fact that all cases of clinical mastitis should be treated. Okay, when clinical mastitis is discovered, it should be treated. No animal should be left, on the farm as a source of infection to other animals, right? And then the final one is that if you have an animal with clinical mastitis that you're treating, okay, you should make sure that you milk that animal last after all the other animals have been treated. Okay, so I said that was the final one, but I have one more, and that one more is that for every one of those farms, especially because veterinary services are not readily available, those farms need to have a regular routine of testing for subclinical mastitis. All right, so they should test for subclinical mastitis and take note of those animals that are showing or presenting subclinical mastitis. And you test for subclinical mastitis using California mastitis test. All right, the CMT test primarily. Okay, so those are the major things that need to be done in preventing mastitis spread on a farm. Okay, the problem with, you didn't ask about vaccination, but the problem with vaccination is that mastitis is caused by over 150 serovars of bacteria, right? So many species of bacteria and so many subspecies and strains can cause mastitis. So there's hardly a vaccine available that can cover effectively at the moment. Okay, it has not proven to be cost effective yet, to vaccinate in a random environment like we have on our farms. Okay, so does anybody have any further contribution to that?
The last question on the chat box. I learned that CMT reagent is a bit expensive. My question is, what other available
Okay.
or cheaper diagnostic tests can we employ on the field?
Well, I wish I could tell you that I knew one, but at the moment, CMT is cheaper than all the other options for
Yeah, I agree with you.
diagnosis of clinical mastitis in the field.
I agree with
Sorry?
you quite so. I said I agree
Right.
with you 100%.
Exactly. Yes. So even though it's expensive, it's still the cheapest one that's available for now.
Okay, thank you very much. So during the course of your presentation, you
Yes.
mentioned that maybe mastitis might not be relevant in terms of costing in serial services. So that's why I put up a little presentation, maybe 10 slides
Okay.
on the effect of mastitis and reproduction in dairy cows.
Okay. No. Yeah. Okay. But I mentioned that aspect, decreased fecundity, right?
Yes, you did.
Okay. So that's
So,
what you're going to
so
expand on. Okay.
yes, so I'll expatiate on that.
Thank you so much.
Uh,
I'm looking forward to that myself.
I'm not sure if you can see my screen. Can you see my screen?
Yes, sir. Yes, sir.
Yes, sir, we can see it.
Yes, sir.
Okay, so mostly as he mentioned, the actual hidden enemy is subclinical mastitis because clinical mastitis is obvious and it can be detected by even the farm workers to report to the vet or someone in charge of heart health. So, but subclinical mastitis is the hidden enemy, and we have seen the effects on all other aspects of the farm. So I'll just dwell on asking some few questions, and I will answer them in response. Okay, so I have 10 flashcards. So the flashcard number one asks the question: how does subclinical mastitis affect reproductive traits? And doctor has mentioned fecundity, reduced fecundity and fertility. So I'll just elaborate on those areas. So it increases the estrus interval. We know the interval between one estrus and another is 21 days. So we have from studies we have found out that with presence of mastitis, we can have increased inter estrus interval. Instead of 21 days, we can have it to be 23, 24. Or even the animal could skip a whole cycle without showing any estrus sign. Next is the days to first service. This is talking about the postpartum day. So ideally, we expect that the cow should be bred not less than 80 to 85 days after calving. So, but with occurrence of either clinical or subclinical mastitis, you can have an increased number of days to first serving. Instead of the 80 to 85, you can have it running into the hundreds, maybe 110, 120, 150. Then the number of AI per pregnancy. So because of repeat breeder incidence in animals with subclinical mastitis, you see that the number of AI that you do, instead of doing maybe one or two, might need to do three or four. And this will increase the cost of AI, both to the farmer and to the inseminator. And we have also recorded increased abortion rates or um, increased incidence of early pregnancy death, early embryonic death, which the farmer cannot see the signs, and the doctor has to just check for embryonic death through ultrasound. So this is one area that is very essential to investigate. We also have decreases in pregnancy rate and stability. How does all this happen? We'll talk about it in flashcards 2. So flashcard 2 is asking the question, what are the mechanisms through which mastitis impacts reproduction? We have activation of immune responses. Dr. Paul has mentioned the effect of mastitis on immunologic responses through cytokine release, inflammation, hormonal disruptions, interference with ovarian and embryonic development. This diagram shows the possible mechanism in which mastitis can affect reproduction in dairy cows. Inflammation as a result of mastitis can have stimulation of the levels of cytokines like TNF alpha, that's tumor necrotic factor alpha, interleukins, prostaglandins, and the rest. And this will eventually has two main effects. One is directly on the brain, and then it can also have elevated body temperature. So if it's affecting the brain, it's affecting the hypothalamus, which is responsible for production of gonadotropin releasing hormones, and this invariably will affect FSH and then the ovarian activity. Remember, we said while the GnRH is not there, it will affect the cyclicity. So the animal can go without cycling. This is increasing the inter-estrus interval. Also, it can affect the uterus by stimulating PGF2 alpha production, which will cause lipolysis, and this will affect pregnancy. And then you have failure of conception or failure of fertilization because the progesterone levels will be decreased. Indirectly, it can cause elevated body temperature, which will alter follicular growth, poor oocyst maturation, and decrease estrogen synthesis. Once there is decreased estrogen synthesis, the expression of estrus by the animal is also decreased. This will lead to what we call silent heat by the cows. It is the effect on what I just explained now on the CL and follicle estrogen concentration and progesterone concentration. Low estrogen concentration will lead to delayed uh, oocyte egg maturation and ovulation, as well as failure of estrus expression, which will now, if you are using AI based on heat detection, animals will not express heat, and then you are not able to detect estrus. With decreased progesterone, the progesterone is not able to maintain pregnancy, and therefore there's embryonic loss. If it is in the early stage, you have what we call early embryonic death, or later on when the fetus has been formed due to low progesterone, there could be abortion. Then also, cortisol levels can affect directly PGF2 alpha, or can alter with corpus luteum synthesis. Flashcard number 4 is asking which inflammatory cytokines are involved in the effect of mastitis or reproduction. I've mentioned them earlier: tumor necrotic factor alpha, interleukin 6, and insulin interferons that impair with hormone secretion. We've mentioned the effect on estrogen and progesterone, and then it also affects oocyte maturation and embryo survivability. Another flashcard is asking the effect of bacterial lipopolysaccharides, which is a component of the outer membrane of gram-negative bacteria such as E. coli. This LPS has a critical role in impairing fertility in dairy cows by disrupting uterine and ovarian functions. They activate immune responses, causing inflammatory cytokines, hormone disruption, and oocyte apoptosis, which is a programmed cell death of the oocytes, and then embryo abnormalities. This is the immunological response that leads to poor oocytes and embryo quality. Then flashcard number 6 is asking what impact does hypothermia or fever has on fertility. Remember, Dr. Paul mentioned that fever has a direct effect. Fever is one of the signs of clinical mastitis. So when you have elevated body temperature, this can impair with embryo and oocyte development. This reduces steroid hormone synthesis and decreases the conception rate of pregnancy. How does nutrition relate to subclinical mastitis and reproduction? When you have mastitis, this causes reduced feed intake and energy deficits, weakening the immune system and negatively affecting egg quality and embryo quality. Then, flashcard number 8, what is the effect of timing of subclinical mastitis occurrence on fertility? So when you have mastitis occurring around the time of breeding, especially 3 days before AI and up to 32 days after AI, this significantly lowers pregnancy rates and increases the pregnancy losses. So embryonic deaths, after I've mentioned those mechanisms earlier on. So I carried out a little study in 4 farms. We took samples. This is samples based on individual quarters, but we pulled them for each animal. So we carried out CMT, and then after the CMT, we carried out artificial insemination. So interestingly, those animals that were positive for CMT had a lower pregnancy rate. Out of 68 animals that tested positive for CMT, only 4 of them became pregnant, while the 64 were not pregnant. With those animals that did not test positive for CMT, out of about 190 animals that were inseminated, 108 were positive for pregnancy, while 82 were negative. So clearly, this results when we subjected to statistics, this result was significant, which means that mastitis can significantly affect pregnancy rates. Number 9, how does specific pathogens of reproductive outcomes affect from mastitis affect reproductive outcomes? Several studies have been done to isolate the causative organism, as Dr. Paul has mentioned, but 2 of very keen interest are Streptococcus and E. coli. This cause varying degrees of chronicity and influence fertility in dairy cows. This, I think, is closely related to their ability to produce toxins, although most studies are required to establish this relationship. Number 10, what are the management factors that influence the severity of mastitis effect on reproduction? The general immune status of the cow, management practice, as Dr. Paul has mentioned, hygiene, sanitation, nutrition, and all the other factors that were mentioned in prevention of mastitis. So the more severe your biosecurity, the more poor your management practices are, the higher the impact on reproduction. And also it depends on the pathogen types, as we have mentioned. Streptococcus and E. coli are of particular interest, and then timely treatment. The earlier you treat, the better for the outcome. Thank you very much for listening. I'll take questions if there are any. Do you have any questions? Dr. Paul? Yes,
Yes.
Mohammed Koro.
Can you hear me? I had some network issues. I heard you calling my name. I missed out something.
Okay. I said, I was wondering if you had any input.
Actually, I'm just really inspired, particularly by the study, that looked at the success rates, the success rates of conception, comparing positive and negative animals that are positive and negative for California mastitis test. I didn't know that it would be that glaring, the difference. So I don't have any contribution per se. I'm just thinking that I need to have a more in-depth conversation with you about that study. But that would be outside of here. But thank you for
Thank you.
really inspiring. Really.
Any other question? Mohammed Koro.
Okay, let me just type it.
Okay, the question was typed by Koro. In clinical mastitis, we talked about fever affecting reproduction. I did not get that aspect. Okay, remember we said remember the four cardinal signs of inflammation. We said elevated body temperature impairs embryo and oocyte quality, and this reduces steroid and steroid hormone synthesis. Those are estrogen and progesterone, and this will decrease conception rates. If you look at the figure, are you seeing the figure?
No, I'm not seeing your screen, Doc.
Are you seeing my slides?
Not yet for me.
Okay. I guess you can see it, right?
Yes, I can see it now.
Okay. So we said the effect of mastitis on reproduction is either direct or indirect. We said the effect of fever is the indirect effect. It causes increased cortisol level, and cortisol has the ability to impair a hypothalamus pituitary response to stimulation. So there's decreased GnRH secretion. This will affect the release of FSH. And then the other effect of elevated body temperature is that it alters follicular growth and causes poor oocyte maturation and decrease in estrogen synthesis. This will affect the estrous cycle, as you know the role of estrogen in oocyte maturation, ovulation, as well as expression of estrus. Does that answer your question? Koro? Hello? All right. So, thank you very much. In the absence of any other questions, I would like to thank Dr. Paul Amuta for staying with us throughout the presentation, and all other participants for joining us. Do keep a date with us next month for another interesting webinar. Have a wonderful day. Thank you, Dr. Paul.
Thank you very, very much. I'm grateful.
Thank you,
and thank
to
you,
Dr.
everyone.
Paul. Maybe some of them might like to have the presentation. So I think Dr. Paul will share with me so that I would also share with the group.
Okay, yes, I will. Thank you.
All right. Thank you very much. Have a wonderful day.